everyone. I'm Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a story about a man who is 42 years old. He is an earthquake survivor wherein he constantly tried to avoid the thoughts and images related to witnessing the injuries and deaths of others during an earthquake. He tried to begin focusing on his work and involving himself in various activities throughout the days by doing various hobbies. However, when he had free time, he would experience unwanted, intrusive thoughts about the earthquake. In addition to this, he also experienced distressing nightmares. So, I think you would have understood what is the topic that I'm going to explain today. So, the person had, put himself into that, experience that he had, which was really a traumatic event that he had in his life and which caused him a lot of stress. The topic for discussion today is the topic for discussion today is the reaction to stress. This topic, reaction to stress, includes the two main topics, that is the acute stress disorder as well as the post traumatic stress disorder. Let me first move on to the first topic, which is the acute stress reaction. This disorder, that is the acute stress disorder, is characterized by symptoms like anxiety, despair, and anger, and also overactivity. You can note that these symptoms are clearly related to the symptoms of stress. If this particular stressor or a stressful environment is removed, then most probably the person will be able to lead a normal life. So we can simply say that the symptoms can be resolved rapidly. So that is the acute stress reaction. Let us learn the meaning of the acute stress reaction or the disorder, which is termed as ASD. ASD is characterized by symptoms which is similar to the post-traumatic stress disorder that occur immediately in the aftermath of an extremely traumatic event. So, what is this ASD, acute stress disorder? Is a type, we can say, which is similar to the post-traumatic stress disorder, which occurs after the traumatic event. What are the symptoms of this ASD? We have got depersonalization. We have got the dissociative amnesia, that means the person is not able to recall the events which happened during the traumatic situation. The person also ventilates that he's having a subjective sense of numb, detachment, or emotional responsiveness. And also, he will have the derealization. This traumatic event is persistently re experienced in the form of the thoughts, recurrent images of those traumatic events that he will experience, flashback episode, that is, flashback of those trauma that he experienced in his life, sense of reliving the experiences. He may also experience very much a distressful feeling on exposure to reminders of the traumatic events. So, these are the symptoms related to the traumatic event which can persistently disturb the person. Next, I've got the symptoms, that is, the marked symptoms of anxiety and increased arousal, wherein the person will experience the symptoms of difficulty in sleeping, irritability, poor concentration, hypervigilance, motor restlessness, and exaggerated startled response. So these are the symptoms when the person is having the anxiety features, right? So moving on to the cause and prevalence of this ASD, acute stress disorder. The person will experience the symptoms during or immediately after the trauma, which will be lasting for about 2 days, maximum of about 4 weeks, and these symptoms will occur within the 4 weeks of the traumatic event. So you can simply say that the person will experience the symptoms for about 2 to 4 weeks, and within the 4 weeks of the traumatic event, he will experience all these symptoms. It has been reported that about 14 to 33 percentage of people who have experienced the trauma in any kind of the life will experience this acute stress disorder. So that was about the first condition, which is the acute stress reaction or the disorder. Moving on to the second disorder, which is related to the stress, that is the post-traumatic stress disorder. So as the name says, post-traumatic stress disorder, that means after the traumatic event, the person will experience the stressor or the anxiety. PTSD is characterized by hyperarousal, re-experiencing of images of stressful events, and avoidance of reminders. So when does this post-traumatic stress happen? So it happens when the person has experienced the traumatic events in his life, such as being a witness of the natural disasters, okay, like it can be the floods or earthquake, war, or it can be some other abuses that he or assaults that he had experienced in his life, like serious physical assault or rape. If you take the main symptoms or the characteristic features of the post traumatic stress disorder, the person experiences persistent anxiety, irritability, insomnia, intense intrusive images, that is flashbacks about the event, distressing dreams, inability to feel the emotion, as well as diminished interest in the activities. So when does the person experience these symptoms? So the person may develop these symptoms or experience these symptoms after the period of latency, that is most probably after 6 months of the event that he had experienced, or it can be even delayed. So let us see the definition of the post-traumatic stress disorder. So it is a severe psychological disturbance following the traumatic event, which is characterized by involuntary experiencing of elements of the event with the symptoms of hyperarousal, avoidance, and emotional numbing. So, what is the definition? It is simply saying that the person will experience the trauma or the stress after the traumatic event, which will make the person to become very much hyper arousal. Even minute thing which happens around him, he will be very much vigilant, and he will try to avoid those events, and also he will experience numbness. Okay, so that is the definition of post traumatic stress disorder. Moving on to the etiology of post traumatic stress disorder, we have got some theories which will explain this. The number one is the psychodynamic theory. So, according to the psychodynamic theory, the person who has experienced the traumatic event would have a threat to the ego or a threat to the self concept. Because of this, the person experiences the severe anxiety, which cannot be even managed by using the usual coping mechanisms, that is, the ego defense mechanisms. The superego which the person has may become punitive, making him to experience the feeling of guilt, or the id may become very much dominant, resulting in the impulsive or uncontrollable behavior. So that is about the psychodynamic theory, which is mainly explaining about the ego integrity. The person loses the self-concept, or the ego is not able to manage with the stressors or the anxiety with the ego defense mechanism. The superego or the id will take up the personality, and he will have a disturbed life. The next theory is the biological theory. According to the biological theory, they explain that there may be an influence of the genetics. That is, during the in vitro, or when the child is there in the womb itself, if he is exposed, or if the mother is being exposed to any kind of a stressful event or traumatic event that is going to cause a neurological disturbance for the child. So it can be during the period when the child is there in the womb itself, or during the infancy period or developmental stages, if the child had experienced any kind of a traumatic event, later on the child or the person will end up with a post traumatic stress disorder. So that is the biological theory. The next theory is the family dynamics. Family also plays a very important role in the life of a person. So if the person is in a family wherein there is a lot of conflicts, lot of dysfunctions in the family, or if the person is brought up in the family where there is no formal education, or the lifestyle of the family is very poor, then he can end up with the PTSD disorder. So some of those factors which are related to the family, like below average or lack of success in the education, negative parenting behavior, parental poverty, all these factors may contribute for the development of the PTSD. So a current research has also revealed that if the person is brought up in such a kind of a family wherein the family has experienced severe traumatic event, it can even pass on to the next generation. Say, for example, if the person is brought up in such a kind of family where there is a lot of stress, okay, or the mother is experiencing a lot of stress and anxiety, the same thing the child or the children will learn from the mother. So that kind of a trauma or a stress will be passed on to the next generation, which can lead to the disturbance in the mental life of the children. So that is a new research which is found related to passing on of the stressful event from one generation to another generation. So this is about the family theory. So these are the reasons why the person will end up developing the post-traumatic stress disorder. We have got some risk factors which may also contribute. We have got the factors like low education, lower socio economic status, more commonly seen in the female gender, low self esteem, or the personality of a person is a neurotic kind of a personality or neurotic trait the person is having, family history of the psychiatric disorders, especially the mood disorders, as well as the anxiety disorders, previous traumatic event if the person had experienced, that is during the childhood period. So all these are the risk factors which can contribute to the PTSD. Moving on to the screening of the post-traumatic events. So there are certain events which the person would have experienced in his life. So we need to screen for those events, whether he had experienced these events in his life. So what are those? We have got the serious accidents, natural disasters, physical attacks or assaults, sexual assaults, witnessing someone who is treated or beaten very badly or being killed, domestic violence or abuse, physical or emotional abuse during the childhood period, being threatened with a weapon, or being kidnapped or held as captive, certain experiences related to the war, torture, or any kind of an experience of terrorism, or any other stressful event in the life of the person which is seeming to be very upsetting. So these are events that you should be able to screen for when you get a person with the PTSD. Moving on to the symptoms or the clinical features of PTSD, the person will experience the symptoms of nightmares, sleep disturbances, startling responses, anger outbursts, regression behavior, detachment, avoidance of traumatic recollection. So he doesn't want to recollect the traumatic event. So he will try to avoid those. Avoiding to even talk about the traumatic event. Additional symptoms of PTSD that you can note is alienating yourself, or the person will himself try to avoid the stressful event. He may avoid people and even the places wherein he had experienced the stressful event. He may also have panic attacks or panicking in the social situations that he cannot escape. That is like, social phobia that he may experience. Hiding the feelings of anxiety and fear. extreme, laughter, or being very happy or smiling, or always being very joyous, just to, communicate to the other people that he's very happy and he's not having any kind of stress or anxiety. Withdrawing from the relationship with the loved ones, struggling to fall asleep, and in fact, he may stay asleep, reliving the trauma in the form of the dreams or flashback, suffering in the performance at work. He may end up with the abuses like, drug abuse or alcoholic abuse to just mask out his problems. He may avoid the plans for the future. He may have the suicidal thoughts and also a feeling that he is the only person who is facing all such kind of the difficulty. He may feel the loneliness, that he is the only person who is witnessing these kind of the difficulty. So these are all the symptoms that the person will experience with the PTSD. Moving on to the duration of PTSD. So if it is an acute episode, the duration of the symptoms will be less than or equal to 3 months. If it is a chronic post-traumatic stress disorder, we can note that the symptoms the person experience will be more than 3 months period. The next duration we have got a delayed onset, that is after 6 months of the event, that is a traumatic event, the person will experience the symptoms of the trauma. That is, the onset of the symptoms will happen after the 6 months of the experience with a traumatic event. So that is about the duration of the PTSD. Moving on to the diagnostic study. So you're going to first do the drug screening. So you got to find out whether the person is experiencing this kind of a stress because of the influence of certain medications or drugs, or any kind of the abuses. Other diagnostic studies can be also done to rule out the physical disorders or the physical symptoms the person is experiencing, like ECG for the chest pain, mitral valve prolapse, or EEG to identify if the person is having any kind of seizure, thyroid studies. So these are certain diagnostic studies that you will be doing. Apart from that, you're also doing the assessment and the mental status experience to rule out what is the traumatic event that he had experienced in his life. So all these are the diagnostic features or the studies that you can carry out. Moving on to the treatment of PTSD, it is found that the person who receives the treatment will be recovered by 36 months of receiving the treatment, compared to people who don't receive the treatment, who will experience the symptoms for about 64 months. So the treatment of PTSD includes psychotherapy, behavior therapy, and use of the pharmacological agents. The goal of the treatment is to rule out whether the PTSD is a chronic type, and is there any kind of comorbid condition. So any other psychiatric conditions the person is experiencing along with the PTSD, that you're going to rule out, and based on that the treatment can be given. So let us see in detail about the psychological therapy. The first psychological therapy that is used is a cognitive behavior therapy. So why the cognitive behavior therapy? Because the person, repeatedly is having the thoughts of the traumatic events, and even the behavior seems to be very much anxious. So person should undergo a CBT, cognitive behavioral therapy. Before doing that, it's very much important that you collect certain information related to the traumatic event that he had experienced. What are the symptoms and what are the anxiety management techniques that the client used to follow? And also exposure to the stress producing events or the stimuli, and what is the supportive system or the support that he has, that you're going to find out. And also the anger management technique. So these are the things that you're going to assess first and plan for in the cognitive behavioral therapy. The next therapy we have is the psychodynamic therapy. So in the psychodynamic therapy, you're going to make the person to realize what is the reason behind the traumatic event, or which is causing him a stress. So those unconscious conflicts with the person is having should be brought to the level of the conscious, and it has to be released. So that is what is done in the psychodynamic therapy. Moving on to the pharmacological treatment. So, if the person is experiencing the symptoms of depression, anxiety, so you will be administering certain medications. So, for depression, you will be administering the antidepressant agents like SSRIs, TCAs, monoamine oxidase inhibitors, group of drugs. If the person is experiencing the severe anxiety, you will be putting the patient on the anti-anxiety group of drugs like benzodiazepines. If the person is having the symptoms of disturbance in the sleep, then you will be administering certain sedatives which can calm down the client and make him to sleep or rest for a while. So benzodiazepine group of drugs and hypnotics can be administered to induce the sleep. If the person is having repeated thoughts or intrusive thoughts about the traumatic event, you can administer some kind of the drugs like carbamazepine or lithium. If the person is having the hyperarousal symptoms, then you'll be administering SSRI group of drugs, clonidine, lithium, as well as valproate to control the hyperarousal. If the person is having impulsive behavior or hostility, you will be administering the drugs like carbamazepine as well as the valproate. If the person is experiencing any kind of a psychotic symptoms or aggression, being very much aggressive, then he may require the use of the antipsychotic medications. So that is about the medication therapy or the pharmacological treatment for the PTSD. Moving on to the nurse's responsibility or the nursing management. So, when it comes to nursing management, again, you're going to do the nursing assessment, wherein in detail information that you're going to collect about the events that he had experienced, the past experience in his life, the family dynamics. Okay, what is the support system which is available for him? So, what is the coping ability of a person that you're going to assess? So, apart from that, you're going to prioritize the needs of the client. So based on that, you're going to set the nursing diagnosis and plan for the interventions. So some interventions include providing safety for the clients as well as the others. So the client would have experienced the traumatic event, the environment itself feels very unsafe for the client. So always be with the client, reassure him, provide a safe environment to the client, which is the stimuli, environmental stimuli should be very much minimal so that he should not be disturbed, and even the other client should not be disturbed, because the person may have the nightmares, flashbacks, wherein he can have severe anxiety, phobia, which can have a disturbing, thing for the other client. So always provide a safe environment for the client as well as the other patients. Assist the client to enhance the self-esteem, regain the sense of control, okay, self-control, encourage the development of assertiveness and also avoid the aggressive behavior, teach him the management of anger, and also promote the understanding of the present situation. Or you have to be with the client and educate them, counsel them that whatever the situation that he is experiencing, he should take up the control over the situations. The situation should not take over him, but he should be in a place to control the situation. So, his action should be in terms of controlling the situation or event, or even controlling his own self. So, that insight that you're going to instill in the client. And also, you should be able to assist the client as well as the family to realize and make them learn the healthy ways of coping with the various stressors or events which happens in their life. So that is about the nursing intervention. So moving on to the discharge goals, we have got some goals at the end of the treatment or at the end of the discharge. So there are certain goals that the patient has to achieve. Only if the patient is able to achieve that goal, he will be discharged. So what are those discharge goals that we should have? Number one is the self image improvement or the enhancement. So you should be able to develop that self control and self image. Second thing is the individual's feelings and reactions are to be acknowledged, expressed, as well as dealt appropriately. Third is the physical symptoms if the patient add. Okay, those things are to be treated and minimized. The patient has to bring about the changes in the lifestyle, and also the plan should be made for the follow up. Okay, so these are certain discharge goals that the patient has to achieve at the end of the interventions. Right. So post traumatic stress disorder and acute stress disorders are the disorders which are related to the stress, right? Wherein the person should be able to get an insight about the stress and to cope up with those stress so that he can lead a stress free life. Hope you all have understood the topic. Thank you.